you're asking, why do some people have nerve pain and others don't? But in the question is basically, what is neuropathy? What is nerve pain? And why do some people have nerve pain and others don't? Is that the correct? Okay. Okay, well, let's take it this way. First of all, let's say there is, we're going to go over this in much more detail in the rest of the seminar, but it's a good place to start. So, what is peripheral neuropathy? Well, neuropathy is a term used for disorders resulting from an injury to peripheral nerves, to the nerves that are outside the spinal cord that we feel with, pain, we can walk, we feel where our joints are, all those things. It can be caused by diseases that affect only the nerves, or by conditions that affect other parts of the body as well. And it usually causes clumsiness, difficulty walking, fatigue, muscle weakness, numbness, or pain. But not always does it cause all of those, and sometimes it hits specific nerves that help us with specific things, like walking a straight line, or it may be a very painful neuropathy. Usually it's going to hit the arms and the legs, but it can involve the facial nerves. It can involve the nerves of the trunk. So we're going to go over neurobiology and a lot of things, but that's basically peripheral neuropathy. Okay? Now, neuropathies are different. They affect different nerves, different nerve types. We're going to get into that in much more detail. But just because you have a neuropathy does not mean you have nerve pain. It means something's wrong with your nerves. Neuropathy means disease of the nerves, but it doesn't mean you have pain. So now, let's look at what neuropathic pain or nerve pain is. Nerve pain is typically a chronic pain syndrome. It can be brief. Some people will have pain with shingles. Okay, some people might have a nerve root down their leg that's a radicular pain or nerve root pain that doesn't last that long. Some people may have a trigeminal facial nerve pain, which could be severe, but it may not last. But typically, when we're talking about neuropathic pain, we're talking about a chronic pain that is dysfunction in the peripheral nervous system. There are central nervous system neuropathic pains, but we're not discussing that right now. Millions of people can have these neuropathic pain syndromes. Okay, so nerve pain is pain in the nerve. Not all neuropathies have nerve pain. Neuropathic pain syndromes, which are usually chronic nerve pain, usually peripheral nerves, are long-term chronic pain syndromes, like post-herpetic or post-shingles neuralgia, painful diabetic neuropathy, phantom limb pain, post-traumatic nerve pain, complex regional pain syndrome, 1 or 2 used to be known as reflex sympathetic dystrophy or causalgia, trigeminal neuralgia, neuropathic low back pain or radicular pain, chemotherapy-related neuropathic pain, or a central nervous system example of neuropathic pain would be post-stroke thalamic-induced pain syndrome. So again, neuropathy, damage to the peripheral nerves, that's a peripheral neuropathy from a disease process, resulting in dysfunction of the nerves but not always pain. Nerve pain, a pain in the nerve, usually peripheral nerve, but could be centrally related. But when we say nerve pain, we usually mean pain in the nerve, tingling, numbness, sharp, lancinating pain, the typical burning pain, all right, and neuropathic pain syndromes, chronic nerve pain syndromes. Okay? Now, the most common one, and what most people have that are here, is diabetic neuropathy. Not all people that have certain neuropathies have certain symptoms, and it varies. It varies depending on how severe your disease is, your genetics, what other kinds of things you bring to the party, other diseases, past trauma, work, related injuries. All kinds of things have to do with how much nerve pain you have. We have people here that have diabetic neuropathy that have no pain, but they have severe numbness and they step on things. We have people here that don't have very bad diabetes but have already developed neuropathy because the nerves sometimes are one of the first things to signal you've got diabetes. And they have severe pain. It's very disabling for them. So diabetic neuropathy is a type of nerve disease from diabetes, high blood sugars. It's not directly from the nerves. It's from the body's endocrine system not working right, causing high blood sugars, causing nerve damage through the arterial system of the nerves, and some other things. We'll talk about that more. But the high blood sugar results in the nerve fibers throughout the body getting damaged, causing walking problems, causing feeling problems, causing sexual dysfunction, and often causing pain. The pain is usually in the farthest portion of your extremities, where the longest portion of your nerves, where the end of your nerves, the longer nerves go first, typically. It can also cause neuropathy problems with your digestive system. You don't empty your stomach right, you don't empty your colon right, urinary tract, other things. But a lot of people, the major symptom is painful feet, disabling pain. Okay?